It's great to be here. I really appreciate them inviting me to be able to present some of the things I presented to the deacons in the deacon classes. This session here will be ministering to the 99, and especially I'm thinking the homebound, primarily shut-ins, what we call shut-ins, but also people who might be homebound for other reasons and so forth, and then also making hospital visits. There's some things that will overlap in that. So one of the things I want to ask you offhand, how many of you as elders currently make homebound visits or hospital visits? Okay, a few of you do, all right? And maybe you want to share as we discuss, these visits, share from your experiences. This is one, by the way, this is one way that you can help to support your pastor and also to just enjoy ministry in the congregation in reaching out to brothers and sisters in Christ who, in one way or another, are in need. I just retired at the end of last May after 29 years at St. Mark and Flint. Was at St. Peter Macomb before that for 11. So in 40 years of ministry, when I look back on that, one of the true joys in ministry was one-on-one. Oh boy. Let's go back. How do I go back? Okay, go ahead. Okay, good. Well, I'll wait till I need to do that, and then we'll go. Anyways, the one-on-one ministry, to me, the visitations were one of the greatest joys in ministry. And it appeared that, and one of the reasons why it's greatest joy is because it has to do with relationships and building relationships with people. But also it appears that a lot of ministry for the kingdom can be done as you just visit people one-on-one. So that's something I just thoroughly enjoy. And I hope that you will have that joy too, to be used by God to impact people's lives, for Him. And so one of the first things I want to take a look at in making homebound visits and hospital visits, some things that go without saying, but still need to be said. First of all, discuss with your pastor the care receiver situation. It helps to know a little bit about the person that you're going to be visiting. If the person's in the hospital, talk to your pastor, especially if you don't already know what the person's situation is in the hospital, why are they in the hospital, maybe how long they have been, and so forth. If it's a homebound visit, what's going through that person's life, that they are homebound. So as much information that your pastor can share with you about the person that you need to know ahead of time is just very, very helpful. Also, review notes from a previous visit, if applicable. One of the things I do want to encourage you to do when you make a visit, don't take notes during a visit, but after the visit, while it's still fresh in your mind, just jot down a few notes, things that you don't want to forget, things that you may want to pray to the Lord about, about that person, or for that person, and also when you make a follow-up visit, what do you want to remember so you can bring that up in the follow-up visit? So I just want to encourage you to take some notes. Pray ahead of time about the visit. Okay, so let me ask you this. What should you pray about? Let's say you're going to visit someone in the hospital. But before you go visit them, you're going to pray to God about this visit. What should you pray for?
Listening ear.
What's that?
Listening ear.
A listening ear? Yeah, Lord, give me a listening ear. Help me to really try to comprehend and understand what this person's going through. What else?
Patience.
What's that?
Patience.
I'm sorry, you didn't.
Patience.
Patience, yeah. There will be people who just will talk on and on and on and on, and you got to be patient about that. Okay, I mean, there's sometimes, especially like with shut-ins, you don't get many people to visit them. They just love to talk, and that's okay. You're meeting a need there, But sometimes you have a hard time getting a word in as well. But what else? Yeah.
That God would lead me in that I'm not directing the conversation.
Okay. Yeah, that God will lead you in that conversation. So he's directing it, yeah, not you. Somebody else had their hand up.
I was just going to say to say the right things. For God to help you.
Okay, to say the right things. Pray for wisdom. Pray for wisdom. Okay? And again, pray for whatever that person's situation might be. And just to pray, God, use me to help that person. Okay, next. Make an appointment and be on time. Now, this is not for the hospital one, okay? This would be for the homebound. I never like to just show up unannounced, even though sometimes people would say, Pastor, just come anytime. But make an appointment, and it's only common courtesy to be on time, rather than saying, okay, I'll stop by at 2 o'clock, and then you show up at 2:30, and they may wonder, are you even coming? So it's just common courtesy. The next one is, what about animals? If they have pets, okay, and if you happen to be allergic to them, because you may be, and if you're allergic, let's say to dogs, and that person has a dog, and this is a homebound visit, you may want to mention that to your pastor and possibly have another elder make that visit, okay, because you don't want to go there and you're sneezing and your nose is running all the time. You get that. But also be prepared if they have pets, that those pets may be meandering around you a lot. That's happened to me a lot. I know that, especially when we start to give communion, I had to make sure that the cats didn't get into the communionware. Okay, I had to guard that. My only point here is be aware of pets in the home, and especially if you happen to be allergic, be sensitive to that. Okay. Now, the next slide is some things that go without saying but need to be said, especially regarding hospital visits. Check to see if the patient's still in the hospital and what the visitation hours are. I can't tell you how many times I've gone to the hospital and the patient's already been discharged. So, and it took me a while. I'm not smart enough, but it took me a while to say, I need to call ahead of time. So I would call the hospital and ask, is so-and-so still there? And they would say, yeah. Sometimes the person was and sometimes the person wasn't. Because if I would call, let's say, in the morning, and I would go right after lunch, well, the patient was discharged, let's say at noon. So what I learned to do is either A, contact a family member, because they would pretty much know if that person's getting out that day, or actually talk to the person in the hospital if they have a phone in their room, or if they would happen to have their cell phone on them, and if they're able to talk. Obviously, if they're in intensive care, they're not going to be able to answer a phone. So you may want to contact if they're in intensive care, they're probably still in the hospital, but just make sure. It'll save you a trip, okay? It'll save you a trip. Okay.
I had a question about HIPAA laws, and I'm just curious what other people's experience has been. Obviously, they're not going to tell you anything about the condition of the person.
Right.
I always identify myself as a pastor. I don't know if that helps at all, but I've never really had anybody not tell me that so-and-so is there, or
Right.
what room they're in, or what time the surgery is. And
Right.
I don't know if lay people would have that same experience or not. If I say I'm a pastor, does that help? Maybe it doesn't matter.
Okay, yeah, you want to respond to
There
that?
are certain situations that I've run into where even as a pastor, you'll ask and they'll say they're not here, and that has to do with how they're put in. So like someone who, for example, would be a victim of domestic abuse might have a certain code.
True.
And so
Right.
in those cases, you just need to be talking with the family members that know, and they'll give you the information.
That's true. Also, if they happen to be on a psychiatric ward, they oftentimes don't give that information out. Sometimes the patients are allowed to give the staff their names of people that are authorized to call, and you would have to talk to the nurse that's on duty there, and they can make sure that the patient gives. But it's a good question. As a pastor, I've never had that issue of them not telling me. And as elders, what I would encourage you to do, if you do contact the hospital, is to say, I'm an elder at such and such a church. I'd like to make a visit for my pastor. And so that gives you some authority that they would, give you that information, at least if that person's still there.
If
So,
a person's been discharged, they don't usually say whether they went to rehab,
No.
whether they went home.
correct.
And if they did go to rehab, they won't tell you which one.
Right. I tried that, asking those questions, but no, they won't tell you where they've gone. Yeah, that's why it's always best maybe to call the family, just to make sure, yeah. Okay, next one. Oh, if the patient's door is closed, check at the nurse's station to see if it's okay to enter, because you don't want to just walk in and the patient is, not presentable, okay? And so I've oftentimes just gone to the nurse's station and said, I would like to visit so-and-so, the door is closed, and then usually the nurse will check to just make sure everything is all right, that you can go in, there. And also, if you need to wear a gown or a mask, do so. You may not feel like doing so, but it's for your protection, as well as the patient's, protection, and just go ahead and do that. Plus, then you won't have a nurse saying, hey, you got to wear a gown or a mask, okay? Okay, next. If the patient's not in the room and won't be for some time, leave a message. That's why it might be helpful for you to carry a pen and maybe just a small pad of paper. And with the message, I would just simply say, state your name. And I'm, like say, Gary Beck. I'm an elder from the church, and I'm just stopping by to visit with you. The reason why you would leave a message is that obviously communicates to that patient that someone from the church came, the church cares, okay? And maybe even say, I'm praying for you, and I will visit you another time. And by the way, if you ever tell a person I'm praying for you, what should you do? Pray for them. Don't just say it, but pray for them. But it's helpful to leave a note. Yeah.
Often, I would guess an elder would do that. I'm taking last Sunday's bulletin, everything that we got that.
Good idea.
Yeah, portals of prayer or something.
And portals of prayer? Yeah.
Maybe you're going to address this already, but I'm wondering what you can do in a congregation to help the members feel like if an elder comes to visit them, that counts. And
Good point. Good point. No, that's an excellent point, to have the pastors educate the congregation ahead of time, and not just once, but quite often. And it doesn't mean that the pastor will not is not visiting anybody, but the elders are helping the pastor with visitation. And especially, there are some people that, well, listen, it was always my practice, for example, with homebound people, to visit them once a month. Did that religiously, okay? And as far as how many times I would visit somebody in the hospital, it all depends why they were in the hospital and what the person's condition was and how severe. What is helpful, and whether in a large or small congregation, is even though the pastor is also making visits, for you as an elder to make visits, and that, if you want to say, saves the pastor extra time. If somebody needs more ongoing visits, you can help supply that. And that's a great way to not only to support your pastor, but to minister to your brothers and sisters in Christ. But, yeah, good point. Other questions? Yeah, Mike.
Yeah, just to piggyback off what Paul said, I like what was, I think Rob said it early on, that elders are an extension of the pastor's office. Boy, the more we can communicate and educate that point, the freer we are to allow an elder to take our place in some of these things. And because he's absolutely right that, well, the pastor didn't come.
Yeah.
Well, the elder did, and he's probably better at it than the pastor is.
Maybe.
So, just to educate the congregation that
Yeah.
elders are an extension of the pastor's office.
Yeah. Yeah, and that's absolutely key in educating the congregation. So, and the educating the congregation can come from both pastor as well as elders. So it's not just a pastor's idea; it's coming from the elders. Other comments or questions before we continue? Yeah.
It's been my experience over the years that almost every home visit, they would like to have communion. And without a pastor there, you're limited as an elder.
Okay. We'll talk about that. And in fact, when we get to that point, I'm going to defer to Dr. Casper to mention something as far as district thoughts on that. But yeah, we'll talk about that in a minute. Okay, the next section here is kind of some guidelines for the visit itself. First thing is, and this is obvious, introduce yourself if the person doesn't know you. And you may want to mention, too, if the person really doesn't know you, that you are an elder from the church, and you're coming here, at pastor's request, not that you're taking the place of a pastor and he'll never visit, but again, you're as an elder, you're an extension of that office. But anyways, introduce yourself. Secondly, connect meaningfully. Just to say something like, "It's good to see you," or "How are things going for you today?" Right? It just kind of gets the ball rolling, okay? Let your conversation flow. The third one is let your conversation flow naturally. Be genuine. I remember back when I was a seminary student and the fieldwork church that I was working with in Fort Wayne, they gave evangelism training in Kennedy evangelism. How many of you have been trained in Kennedy evangelism? Okay. Well, if you've been trained in that, you know that there's kind of an outline, law gospel outline that you're to use, and also you talk about illustrations and so forth. Well, I went to this house, and there was a couple there, middle-aged couple, and I presented the Kennedy outline there. And the whole time in my mind, I'm thinking, okay, point A, point. I was thinking of the whole outline, exactly what I need to say, and I figure, okay, I need to make my spiel before I forget, the points at the bottom. It wasn't genuine. I was just trying to follow my outline. That's why I'm not giving you an outline exactly of what to say when you make a visit. Let the conversation flow naturally. If I would have done that visit right, I would have, and we're going to talk more about this, just ask some questions and listen. And maybe to find out where are they spiritually, okay? And then address that and talk about that. I never made a Kennedy evangelism visit since, okay? My style is a little bit obviously different now. But my point being is, that visit was very wooden. I was just trying to follow in my mind what I was supposed to say according to the training. I didn't let the conversation flow naturally. So that's a key. You're talking to a fellow human being, a fellow person, and just talking as you would be sitting down talking to a friend. Next thing is, it was helpful. Get an update. Like, for example, if they're in the hospital and they had surgery a couple days ago, you may simply want to ask, how are you doing recovering from surgery? How are you doing today? Okay? Or if they're homebound. And let's say you've already visited them before, just to say something like, how are things going since the last time I saw you? Just things like that. And it gets the conversation flowing. So it helps sometimes to get an update, and then that can kind of guide you into other questions you may want to ask. All right? The next one is do more listening than talking. Don't dominate the conversation, because it's not about you. It's about the person you're ministering to. Now, as I mentioned before, there may be some people in which you'll have a hard time saying anything because they're just talking on and on and on. There are some people, a few shut-ins I've had, that it was difficult to say even time, hey, can I give you a devotion? Or can I share a devotion? But also there will be those people that don't hardly talk at all. And it's hard to get them, to say things. And that's when it's good just to ask open-ended questions, at least. But do more listening than talking. And my question for you is this. When you're doing the listening, What are you listening for?
Needs and wants.
Needs and wants. Okay? What else?
Where they are in their faith.
Where they are in their faith. Because hopefully, and we'll talk about this, you want to guide it in some way to a spiritual discussion, even if that flows from the devotions you may have.
Feelings.
Feelings, yeah. How are they feeling? How are they responding to whatever they're going through? Okay? I'm going to talk more about that towards the end of this presentation here. If you do more listening than talking, you'll know better how to respond. You'll know better where they're coming from. How are they taking this situation emotionally and spiritually? And do active listening. What's the difference between listening and hearing?
What's that?
What's the difference between... I get it. Takes me a while. Okay, what's that?
Well, active listeners will say things that will encourage them to continue whatever they're
Sure.
talking about.
Sure. Yeah. If in your mind you're trying to think about what you want to say next, in other words, if you think you have the outline and you're not really listening, you're just hearing. And then it'd be hard to respond, yeah. So active listening is key.
I find a lot more, how do I want to put this? I ask questions to get to bring conversation around.
Sure.
But even if it's a first visit or second visit or third visit, I ask them about the past. Because the older they are, the more they have, you're making a friend by the time you walk out. And so the next visit is just so much easier.
Sure.
So much more natural.
Absolutely. And by the way, they like talking about their past too. That's a good thing. Yeah. Okay, next one. Yeah, I'm sorry. Question.
A lot of the shut-ins are lonely.
Absolutely.
They want to talk. And talk about church people, how the church is doing, that kind of stuff.
Sure.
And just let them talk. I mean, I had a couple ladies, I figured I'd plan on 2 hours because they would just talk.
Yeah. And that's meeting a need, letting them talk. Absolutely. Okay. Yeah.
Somebody had said wants and needs. What would you suggest when the person is sharing complaints about the family and feeling neglected, or perhaps if they're in a facility that the care isn't good, or they're not being responsive, or they're forcing them to do something they don't want to do? Is there any sort of advocate role, or is it best to try to steer clear of that role?
My thought would be in the last example you mentioned, I would talk to the patient's family, and say, this is what the patient has told me.
Yeah.
Because if there's going to be any advocate, it probably should come from the family. I would not personally go and talk to let's say the people at the hospital or whatever, but I would let the family know, because the family may not already know. So that would be a good thing. And I forget, what was your first example?
Well, sometimes their complaint is about the family.
Oh, about the family.
So-and-so is not coming
Yeah.
to me, and so is it your job now to go and talk to that family member, or?
Well, first of all, at the visit, I would just listen. Let the person vent.
Right.
Okay? Chances are, if the person's complaining about the family knows already, that. I guess it depends upon what the person's saying and how, I don't want to say important, but what the issues are. They just use the wisdom and say, I do need to talk to a family member about this, and just say, this is what the person is saying. So, but now, excuse me, having said that, we also have to be careful about, let's see, what's the word? Confidentiality, yeah. Yeah, so if there's that sense of confidentiality, then no. Because like in counseling situations, no, we wouldn't do that. So if it's a situation in which there's confidentiality, then you wouldn't be able to tell the family. because you still want the person to be open and honest with you. And if the person thinks, oh, okay, you keep on going to the family and telling, then that might undermine that. So I guess you have to take a look at the situation, and say, what's the wisest thing to do? If it's something that for the care receiver's own protection, we'll say, then you may need to talk to somebody. Yeah.
Would it make more sense as an elder if we are visiting somebody and they are complaining about whether it's the facility they're in or things like that, if you don't really know the family well, to come back and let the pastor know and maybe he has that conversation
Sure.
or something like that? Because the family doesn't really
Yeah.
know you, they might not understand you.
By the way, I would let, no matter what the situation is, I would report back to the pastor, even if it's to say, well, nothing new with so-and-so, okay? But this is what I've heard, because since you're an extension of the pastor, you should let the pastor know what you've heard, so. Okay, next one here. Follow the other person's lead. Don't set the agenda yourself, but again, just follow where they're leading. Now, if there's an elephant in the room, let's say, for an example, the homebound person you're visiting is just under hospice care, and the person is dying. I would hope that at some point in the visit, you would find out, how do they feel about that? How are they emotionally and spiritually responding to that, okay? But the person may not want to exactly talk about that right away, so they may be in left field. They may say, hey, I think the Detroit Tigers really have a good chance this year, and so forth, and they may want to talk about other stuff. And let them talk for a while, okay? But at some point, it's helpful to get the conversation, using questions, back to what that elephant in the room is about. And by the way, one of the things I've often found is that, for example, if a person is dying and they're in hospice care, sometimes the family members are in denial, or at least the family members don't want to talk about death and dying to the person. And I know as a pastor, sometimes I'm one of the few people that talk to this person about their dying. And the family members just don't want to deal with that, don't want to talk about that. So you can play an important role, for example, in a case like that. So if there's an elephant in the room for whatever issue, at least have that in your mind. And if the person's out in left field, somehow bring them back, with the discussion, talk about it. Okay. The next one. Focus on the person, not yourself. Remember, it's not about you. It's about the person. It's not about you saying, okay, made that visit, check it off. It's not a list of things to do, but it's a ministry to enjoy. A ministry to enjoy. So remember, it's about the person. Okay, next one. Continue guidelines. Listen and look for something that you can use as a bridge to a spiritual conversation. Maybe that person is saying, I just entered hospice. Or, I'm really lonely. My spouse died a few weeks ago. Still grieving. If a person's grieving in your devotion, maybe share what? The hope we have in Christ of life eternal. But still allow the person to grieve, right? I've had people cry in front of me and apologize for it. And I've always said, you have no reason to apologize. Jesus wept when his good friend Lazarus died, and Jesus knew he was going to raise him the next minute, and he still cried. It's okay for you, and it's okay for you guys to cry. And a lot of times with men, I'll say that right out. Sometimes it's harder for us guys to cry, but there's no greater man than Jesus Christ. And if he could cry, we can cry. So allow them to do it, but also share the hope of eternal life. As Paul says, we grieve, but not as those who have no hope. Okay? So look for something that you can use as a bridge. Maybe they're very, very anxious about an upcoming surgery. okay? And you can share with them that God's grace is sufficient for them. I mean, obviously there's no guarantees how the surgery may come out, right? But they're in God's hands. And you can share with them, talk about spiritual conversation. And by the way, if one of them say they're very anxious about, let's say, a surgery coming up, just to ask the question, what's bothering you the most about it? In other words, try to get them to be more specific and talk about that anxiety. And I guess what I'm saying is that if they would say something like that, don't right away give a Bible passage. Keep on listening. Keep on asking the questions. Let them talk about their anxiety, or let them talk about their fears. That's in and of itself very therapeutic, and that in and of itself will lead to spiritual conversations. Again, you want them to talk about what's inside them. You don't want to short-circuit their conversation by immediately, say, giving a Bible passage. If that makes sense, okay? Also, like if you're in their homes, sometimes they'll have like a picture with a Bible passage under it. And just to say something, I love that picture. Great Bible passage. That passage must be very meaningful to you. Probably is. Like, for example, a lot of them I see is, be still to know that I am God. And to even say, why is that so meaningful to you? Ask the questions. And let them share that, okay? So just look for something, whether it's in the home or something that they say that can be a bridge to a spiritual conversation. Anybody else have any other examples on that, those who have visited people?
I use that last one that you just talked about. I had the privilege, it was a privilege, of a man that didn't attend church very often. It was mainly his wife that bring him, but he knows story. His wife had died, I don't know, a couple years before, and he was now on hospice care, but he was at home. And when I went in, the first time to meet him, the only time, by the way, I met him, is his caretaker was just leaving to give us some time alone. And she says he's really grumpy. I'm just going to tell you now.
He's really what?
He's going to be really grumpy.
Oh, okay.
So I walked in, and he gave me this sideways, look, like, oh boy, I went to the church. I spent an hour and a half with that man. Not only did I have him laughing, he teared up a few times, but he was a guy that wasn't really involved, and he professed his faith.
Great.
He brought it up.
Yeah.
But what led to it, I'm going to go back to your example. There was a picture, and there was a Bible passage, and I didn't stop to read it. I just noticed it, and I sat down. I brought it in conversation. He goes, oh, that's early in the conversation. He says, oh, yeah, well, that was my wife. Yeah, okay. But he did, peaceful to me to know that he did have faith.
Sure. Great.
But I think maybe 2 weeks later he passed away.
Yeah. Okay.
But he was a good spot.
Good example. And by the way, many may have crosses on their walls. And at some point, just to point that out, and then share the gospel. Okay, the next one is having a devotion in prayer. Dr. Casper is going to be leading this in the 4th session about how to write a devotion and talk about prayer. So I'm not going to comment on that now, other than to say, relate both to their lives, both in your devotion as well as the prayer that you have. Relate them both to what they are experiencing. Okay? And that's why it's so important to do a lot of listening, so that you can do that. Now, the next one is, what about serving the Lord's Supper? And I'll defer to Dr. Casper on this one.
Talk to your pastor. No, seriously, I think there is part of it is because of need, but also I would normally defer if you have a pastor that's actively serving your congregation. That's not like his gig. That's his responsibility. We're in sacrament ministry. On the other hand, if there's, we have like 39 shut-ins, plus hospital visits.
Yeah.
And to visit them every month, I can't just like get there every month. So that would be all I do. So we have this rotation system that we use, and elders would do it one time. And again, it's educating your congregation. In no way did people consider that the elders were taking, over the pastoral office. That was not at all. Or that it was not the Lord's Supper. They were commissioned by the congregation in those unique situations to do that. But if your pastor says, no, I think that's like I'm gonna keep that just for my role as pastor, that's fine. I'm not judging them either. But I think there's a place for that conversation. Because the sacrament has its power in the Word of God and His promises. And we don't do that flippantly. We're given the office, and we're called into that office as pastors to administrate Word and Sacrament. That said, please respect your pastor, honor that role. If it's a need and you don't have a pastor, next one up is talk to your circuit visitor. Who's a circuit visitor? Mike, Ron, who we got? Alex, are you circuit visitor yet?
He's under Mike.
Okay. So circuit visitor. So it's not an automatic, but don't, if they request communion, don't assume as an elder that you're going to take them communion. That needs to be a decision that's made well ahead of time, and that's a group decision by your congregation. Please don't be flippant about it. Talk with your pastor, and then he can talk with the circuit visitors, and that could be a nomenclature or what's the word I'm looking for? Not nomenclature, but casuistry at their circuit meeting. And there'll be disagreement, and that's okay. Disagreement is okay. Just be respectful of the office, but also be respectful of the sacrament. And I think that's enough about that.
Sure.
You wanted to get that on tape? Okay.
Okay. Also to remind you, if you do give communion, make sure you make a copy of the words of institution, from the hymnal to take with you. So obviously you get the words right and so forth. And the other thing you may want to do if you're going to get communion, if you want to have them recite the Apostles' Creed, or if you want to share the Apostles' Creed in the Lord's Prayer, just make a copy of the inside cover of the hymnal of LSB, and it's right there. So you may want to include that as far as your communion type service in addition to a devotion. Oh.
I just wanted to say that I think sometimes in the interest of having a high view of the pastoral office, we might not want the lay elders to actually consecrate the elements. And I get that. Personally, I think it's worse when we have such a high view of the office that we go around distributing the sacrament without saying the words of institution over the elements.
Right.
To me, that's more troublesome theologically.
Exactly.
Yeah.
It doesn't have to be one or the other. I had a lot of vicars back in the day, of course, in the military, and had a large congregation. And so my vicars would do it upon occasion. They would say, at the last divine service, our pastor spoke these words, and we accept the words of institution over.
Yeah, exactly. That's good. Okay.
We're using the very elements that were used the previous Sunday then.
Right.
And that's good.
Okay. Next one. What if family members are present? Like go to the hospital, it's not just a patient there, but there are family members there. Minister to them. And even in the home, if family members are present, minister to them. There have been many a situation I've seen, like if there's, you got the patient, but if a family member, let's say, is their caregiver, oftentimes the caregiver needs just as much, if not more, ministry and attention than the patient does. So, and be aware of that. And so minister to them, because if their loved one is going through a particularly tough time, so are they as family. So obviously include them. Now, there have been also times where there's a particular situation that the family members wanted me to talk to the care receiver about. So when I show up, after a few moments, they graciously leave the room. Okay, so that I would have, and even if there wasn't some, there have been times I've gone to the hospital and the family members would leave so that I would have time just one-on-one with the patient. That doesn't happen often, okay? But my point is, if they're there, minister to them as well, listen to them as well, follow their lead as well, okay? Because then you really are there for both of them. And then also related to this, in the hospital, be aware of the other patient in the room. If there is one, obviously. With that, sometimes like when it comes to the time where I would pray with the person I'm visiting, I may ask the other patient, what can I pray for you about? Or if there's a devotion, I might share with the other person as well as the patient I'm visiting. My point is, don't totally ignore the person. Now, the tricky thing is if you're giving communion to somebody in the hospital, you have no idea what the other person's coming from. You may want to be more private about that. And so a lot of times I would just kind of pull the curtain at that time just to avoid any uncomfortable things. But anyways, be aware of the other patient. And if needed, minister to that patient, even if they're not a member of your congregation. All right? Okay, next thing. This is regarding the hospital. What should you do when nurses and or doctors enter the room? The first thing, I allow them to do what they need to do. Especially if a doctor comes in, because if I would say to the doctor, I'm sorry, I'm in the middle of my devotion, could you come back in 10 minutes? Who knows when that doctor may come back after making all their other rounds. So especially if a doctor comes in, I will stop my conversation, I would stop my devotion. I'll even end a prayer quickly, okay, if need be, because I don't want that patient to wait for who knows how long for that doctor to return. That's one thing. And I can always, when the doctor leaves, I can always pick it up where I left off. No big deal. And as far as nurses, if they're coming in to give the patient medication, I'm assuming the patient needs that medication at that time. Now, sometimes if a nurse comes in and is just checking the IV, I'll just keep on, talking with the patient or continue with my devotion and so forth. So it may depend why the nurses are coming in. But the bottom line is allow them to do what they need to do. Bottom line is for the patient's best interest as well. And then when they're gone, just pick up where you left off. The other reason why you allow them to do what you need to do is so that you're going to be there, especially if a doctor comes in, to be an extra set of ears for the patient. I can't tell you how important that is, to be that extra set of ears, to truly listen to what that doctor's telling the patient. Because first of all, that patient may not remember everything that the doctor says. And you may pick up on some stuff that the patient doesn't. Maybe the patient has a little dementia and won't remember hardly anything that the doctor says. And especially if there's no family members present, you may need then obviously report back to the family and say, the doctor stopped in when I was there, and this is what the doctor told your loved one, and so forth, just to keep them updated. Yeah.
That, to me, that really is really close to that HIPAA line. I would ask the doctor and ask the patient, do you mind if I stick around while I'm here? But there might be personal stuff that I don't know. To me, that.
Well, I know what you mean. I've never had a doctor that has told me to leave, for one thing. But also, I've had doctors ask the patient if it's okay if he's here.
Understand.
Yeah.
And that's fine. I just said that really.
No, you're right. It can be, yeah. Paul.
I really like to make a visit for prayer prior to a surgery and to catch them about a half an hour before they go under, and
Sure.
and then you run the risk of that anesthesia interview going on. When
That's true.
And then that gets pretty personal, about whether you got false teeth or whatever. And so, yeah, I might step out at those times, but
Yeah,
maybe
yeah.
not
right?
That's a great time, really, to minister to people that are probably most anxious at that moment.
Sure, absolutely.
Unless they've already begun to be sedated.
That's right. That's right, absolutely. The other thing is, a lot of times doctors and or nurses have accents, which make it even maybe difficult to try to understand what they're saying. And maybe the patient just simply has a hard time hearing. So it's just helpful if you're there when a doctor or nurse are giving important details about the situation, to be that extra set of ears. And when they leave, I'll oftentimes ask the patient, do you understand what the doctor said? Just to see if the patient got it or not. Or even with the family members, if they're there, you understand. But I tell you, it really takes intense listening sometimes to try to grasp it all. The next thing here is ask needed questions that the patient and the family are not asking. Now, what you don't want to do is right away ask the questions that you think should be asked. Allow the patient and the family to ask those questions of the doctor first, okay? And then oftentimes when the doctor is done, the doctor may say any other questions or whatever. If at that point there are questions that I think the patient should be asking or the family should be asking, but they haven't, that's when I'll ask them. And afterwards, the patients have always said, thank you, Pastor, for asking this question. I never even thought of asking that. It might be something like, the doctor comes in and says, okay, we're doing the surgery tomorrow. This is what I'm going to do in surgery and so forth. But doesn't say anything about what the recuperation is going to be like, okay? And if the patient or the family members don't ask that, I'll ask that, so that it's not going to be a surprise to the patient as far as what to experience probably as far as recuperation, okay? So the bottom line is, ask yourself, if I was the patient, what questions would I have? What would I want to know if I was the patient and this doctor was telling that to me, given that situation? And so at the end, you need to ask questions of the doctor and the nurses. Do it, but you do it for the benefit of the patient and the family. Any other questions on that before we address something else here? Okay, what I want to share with you, a few things that are best not to say. First of all, I know how you feel. Why should you not say that? You don't know how. Even worse than this, it would be to say, I know exactly how you feel. Why don't you know how they feel? Because no two situations are exactly the same, and no two people are exactly the same, right? You may, let's say, experience the death of a brother, and this other person is experiencing the death of a brother. That doesn't mean this person is feeling exactly what you're feeling upon the death of your brother, okay? No two people are exactly the same, and no two situations are exactly the same. Best to ask, how are you doing? Because your brother died. Or how do you feel? Let the person, express that. And sometimes I will say, I can only try to imagine what you're feeling. Which communicates, I'm trying to understand how you're feeling. But I don't know exactly how you are. Because if you would say, I know how you feel, the person maybe won't tell you, but will be thinking what? You don't know how I feel. Okay, the next one. This next one I have heard many, many a time. God doesn't give you any more than you can handle. What's wrong with this statement? It's false. It's not biblical. I think some people have in mind 1 Corinthians 10:13, which says, God will not give you more in temptation. God will not give you more than what you can handle, but when you are tempted, he will provide a way out. But the context there is temptation. Okay, it's not a struggle just of any kind in any situation. And look at the statement itself. First of all, God doesn't give you. That puts the blame on God for all the tough stuff you're experiencing, right? Now, obviously, God allows stuff, because if he didn't allow it, it wouldn't happen. But that may be saying God's actually causing it. Maybe not be Satan causing it, may not be the world causing it, or somebody else's sin against me causing it. But we're blaming God for all the tough stuff that we're experiencing. And then look at the next part. More than you can handle. That's putting the emphasis on what? Your abilities. Your abilities to hopefully overcome that. Better to say, God will help you handle what you are experiencing. That is biblical. Jesus says, I am with you always. Never will I leave you. Never will I forsake you. He says to Paul and to us, my grace is sufficient for you, for my power is made perfect in your weakness. Will God help you handle what you are experiencing? Will he help you to cope? Yes. But you rely on the grace and the power and the mercy of God rather than on your own abilities to handle this. And again, it was just 2 weeks ago, I had somebody going through a tough time saying, well, I guess God doesn't give me any more than I can handle. Now, I did not get into a biblical study on saying, no, that's not scriptural. I just simply say, I know God will help you to handle this and help you to cope. So, okay, the next one. At least, let's say somebody is going to have a heart catheterization. Rather simple procedure, but the person's never had it before. Person is really anxious about it. And for you to say, well, at least you don't have it as bad as my neighbor who just had triple bypass surgery and a heart replacement, open heart surgery even. Okay? If you would say, at least, what's bad about that?
It minimizes what they're feeling. It makes it not valid.
Exactly. You're minimizing what they're feeling.
Adds additional elements for anxiety.
You're adding additional elements of anxiety to say, boy, am I going to face this too? Or if somebody, let's say a woman has a miscarriage, and to say, well, at least you have 2 other children. Whoa, talk about slap in the face. I've got a couple more here, but here's a resource I cannot recommend highly enough. Don't sing songs to a heavy heart. To say these things, you're singing songs to a heavy heart. And the title of this book comes from Proverbs 25, verse 20. Like one who takes away a garment on a cold day, or like vinegar poured on soda, is one who sings songs to a heavy heart. In other words, you don't want to add to their misery. You don't want to add to their suffering. Okay? You don't want to add to their anxiety. It was written by Ken Houck, the founder of Stephen Ministries. And I've taken, back at St. Mark, I've taken my elders through this. And I've taken my Stephen ministers through this book. And just anybody in the congregation who wanted to reach out and minister to loved ones or fellow church members that are in any way suffering or in need. Excellent, excellent book. It's the best book that I have found anyways in this whole area. They still print, the covering's different, okay, but they still print it. Don't sing songs to a heavy heart. I'll leave this up here if anybody wants to look through it. They obviously still print it. Just want to encourage you, if you want to follow up this seminar with more training, this would be the book to use, okay?
Sure.
Yeah.
I don't know if they mentioned the same thing goes for funeral home.
Yeah.
When you go to your funeral home, that's the worst thing you can say is, I know how you feel.
Yeah. Yeah. That relates to the next one we're going to do here, okay? Well, you know she's in a better place. Have you ever heard that? depending upon where you live, you may think, well, Hawaii's a better place. Okay? Let me just say this. If the person himself or herself says that, then you can affirm it. You know, if a Christian dies and let's say their spouse says, you know, it's tough, but I know she's in a better place, then you can affirm, yeah, she's in heaven with Jesus. You can affirm that. I never used the term better place because there's a lot of better places. I'm going to use the term heaven or being with Jesus. All right? I think that's a little bit better. Let's define what the better place is. But if you tell a person who's grieving before they ever state this, if you say, well, she's in a better place, what might the person be thinking? What's that?
They're wrong. What was wrong with being with me?
What's that?
So what was wrong with her being with me?
Yeah. And I've heard people say this. Yeah, I know she's in heaven. I'm glad for that, but I want her here. I want her here. That's what they're. And even when you affirm that they're in heaven, you may also want to affirm, but I know you miss her, don't you? And let that person talk about what they're feeling, what they're thinking. We take hope, or like Paul says, we grieve, and let the people grieve. But we don't grieve as those who have no hope. And part of what we can do is share that hope. That's the comfort and the encouragement that we can bring. And another one, it's not the next one, but we'll get to that. But it's a blessing. Depending upon the situation upon which the person died, they may say it's a blessing. I wait for the person to say that. And I remember a guy whose wife was in a nursing home for 7 years, really did not have her mind. And when she died, the husband said, it's a blessing. And I affirmed, yeah, it was. In fact, that was the title of my funeral message of what he said, it's a blessing. And we talked about why it was a blessing, but that also, you know, he missed her. Okay, the next one, it must be God's will. The thing is, we don't always know what the will of God is, right? We don't always know. And that's why I try not to speak where the Lord has not spoken, you know, and to say this is God's will. Because they may say, well, it must have been God's will that this person died. It may be God's will that this person has to suffer. My thought is God will work through anything. But let's not, again, blame God where he's not to blame, because we simply don't know, what God's will is. Okay. And there may be other things. So one of the, before we get to the concluding thing, think through yourself. What have people told you when you were in need, or you were grieving, you in the hospital, whatever, that really did not help? Learn from that and not say those things to other people. Also say, what really did help? What helped you in your time in need? And that might give you some ideas on how to share that with others. Okay, and then, and then concluding the visit, you may just simply say, thank you for your time. Or, it was a joy talking to you. And then you may want to say, I'd like to visit with you again. And maybe even, schedule another time. Or, again, I'm praying for you, or like a follow-up. Just anything like that, just to kind of normally conclude a visit. Okay. That's it for this session.